This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Hello, everyone. This is Dr. Famuyiwa, and welcome back to another episode of Fertile Talks with Dr. Yemi Famuyiwa. Today, we're going to be diving into a fascinating and often overlooked topic, which is the role of anesthesia in fertility treatments. So, if you haven't seen my YouTube video, I did a session with one of our seasoned anesthesiologists, Dr. Mark Hestrin, at Montgomery Fertility Center, who has years of expertise, and he plays a crucial role in ensuring that our patients remain safe and comfortable during procedures like egg freezing or cyst aspiration. So I encourage you to go through our YouTube channel to watch it because we show you what a live setup would look like. So here, let's unravel the science and the care behind anesthesia and why it's an integral part of fertility treatments. So for many patients, the idea of anesthesia often feels very mysterious and it's often a little intimidating. But at its core, anesthesia is still about one thing, which is comfort. It is the practice of using medications to eliminate pain and often memory of a procedure. And we go from minimal sedation to full general anesthesia, but usually in a fertility practice, you don't need full general anesthesia. The level that is carefully chosen based on the procedure and the individual's needs. So what do we do? What do we use anesthesia for? Here at Montgomery Fertility Center, anesthesia is primarily used during egg retrieval process. Although the procedure itself is very quick, it requires precision and focus, and that's where anesthesia becomes essential. The goal is very simple: no pain, no awareness, and no memory of the procedure afterwards. So thanks to experts like Dr. Hestrin, patients can feel assured that their experience will be one of comfort. The anesthesia process. This involves administering anesthesia in a meticulous process designed to prioritize safety and comfort. Here's how it works. It's 3 steps. Number 1, preparation. The patients are instructed to fast overnight before the procedure to reduce risk of aspiration. Now, I'll tell you a little story. I had a patient once who was coming for her egg retrieval, and I usually ask them just to see, it's a trick question. I said, well, how was breakfast? And she was smacking her lips. She had eaten oxtail soup, spicy oxtail soup, right? And she had eaten it that morning. And this patient was also a physician. So I'm like, oh, we can't do your procedure. We're going to have to cancel, right? Because there's a risk, and we'll go into this later. There's a risk that you could aspirate this spicy, delicious oxtail soup, and it goes into the lungs and causes severe inflammation in the lungs and could be life threatening. It could be life threatening. Also, chewing gum. You may think you're not eating, but if you chew gum, you're salivating all those delicious flavor. So, and when you salivate a lot, you swallow the excess saliva. So, guess what? Your stomach is full of saliva. And you can also regurgitate this, you can throw it up. And the risk, we always care about the risk of aspiration into your lungs. Anyway, back to the anesthesia process. Number 2, monitoring. So during the procedure, vital signs such as blood pressure, heart rate, and oxygen levels are continuously tracked using state-of-the-art equipment. Tailored administration. Number 3, short-acting anesthetics are carefully selected for egg retrievals to ensure a quick recovery of the patient. So safety first. Safety is the foundation of every anesthetic procedure. Dr. Hestrin emphasizes the importance of having fully qualified and certified individuals who can handle the rare but critical situations such as breathing difficulties. At Montgomery Fertility Center, our staff are prepared for any scenario, ensuring the highest level of care. What to expect as a patient? During the egg retrieval process, patients typically receive supplemental oxygen through a nasal cannula, right? A small, comfortable device with prongs that just sits right inside the nostrils, monitoring the equipment and keeping track of key things such as your pulse oximeter, measuring oxygen levels and the heart rate. We measure your blood pressure continuously to track your blood pressure. We also measure what's something called the end-tidal CO2, because if you're producing CO2, it means that you are respiring, you are alive, and you are being monitored. And also we monitor we use an EKG to monitor the heart rhythm to capture any irregularities. Post-procedure care. Once the procedure is complete, our focus now shifts to recovery. Because we use short-acting anesthetics, most patients wake up very quickly with minimal side effects. So you might feel a little groggy or queasy for a short time, but these effects typically resolve within hours, allowing you to head home and rest. So in conclusion, anesthesia is more than just a part of the process. It is a cornerstone of proper patient care in fertility treatments, and it ensures that procedures like egg retrievals are not only effective, but are also painless, stress-free, and safe. So with experts like Dr. Hestrin and advancement in medical technology, we're able to provide a safe and comfortable experience for every patient. Thank you for tuning in today to another episode of Fertile Talks. And again, if you found this to be helpful and insightful, please like, share, and subscribe. We welcome your support. Share with anyone who might benefit from this and from understanding more about the role of anesthesia and fertility care. Until next time, please stay healthy and safe. Yours truly, Dr. Famuyiwa. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.